Hi, my name is Fuad Qureshi. I'm one of the patient experience guys. You might have gotten your snapshots and you might have some questions, and I was thinking I could probably answer some of the questions regarding your snapshot by reviewing this snapshot with you. So let's go over here to the snapshot. This is the snapshot that you have received. Here is your name. This is the sample size, that is the number of patients who have responded to the questionnaires. This area is very important. I know everybody focuses over here, but I think we should be focusing here a lot. What this tells us is that how many patients rated us very poor, poor, fair, good, and very good. There's usually not much you can do about patients who rate you very poor, but you can do a lot about patients who rate you good and bring them to very good. In this case, there are 13% patients who thought this person was good, and 86% thought he was very good. And if we bring those maybe 10% of these people over here, these rankings are just going to go sky high. So that's the most important aspect. This is what you have to look at. So in general, this person, 99% of the people thought that he was or she was doing a great job. So that's really good. Let's move further down. This is a percentile ranking, and this is the mean score. Mean score is very important. This is the actual score that you are getting. So, and this is a percentile ranking. There is a big correlation in that. When you look at your current rank, like suppose 86, and you think you have to go to 90, that's increase of 4%. But actually what you have to look at is your mean score also. And maybe just increasing this 96.1 to a merely 96.6 is going to increase your mean score to 97, or this 0.5 increase can increase your rank to 90th percentile. So, which is very important for you to know that higher percentiles does not mean that you are extremely good, or lower percentile doesn't mean that you are extremely bad. But a combination of the good and the very good, if the combination is a good number, that means you are doing all right and we can work on certain things. So a very small number of patients can increase your percentile rank to a very high number. So suppose, let me give you an example, 10 people said, gave you a ranking, I think 10 would be low, let's take it more than 30 because you have to have a good sample size. 30 patients answered the questionnaire, and 25 thought you were good and 5 thought you were not that good or just good. Moving those 5 patients to the very good area would increase the percentile ranking by a huge number, maybe 20%. So don't go with the percentile rank alone. Look at the mean score also, and you know just 0.5 increase here can increase actually your rank from 86 to 90. Then where do you stand? This is where you stand in the system and the specialty. In this curve, you see this is a curved thing. Anything between here to here. So above the lower end and below the upper end is median. And you will see many times changes of your score from here to here, and that is just noise, and don't worry about it a lot. You have to focus on what can you change about your practice to improve things. To find out what you can actually do to improve your practice, you have to look at these little things. And if you look at this, this is a recurrence thing. What it says over here is care provider information about medication. This time period, it was number 1. Patients thought that you were unable to provide them this, ranking 1. That was their number 1 concern. Last time, it was their number 4th concern. So it seems like there is a recurrent problems going on. So if you focus on the medication issue, on this questionnaire alone, you can improve and have a huge impact on your mean scores as well as your percentile ranking. That is, we are trying to move these patients from this good to very good. That should be the goal. So it's quite simple. If you guys have any questions, please do not hesitate to call me. You can talk to your administrator, your department leads, and of course at any time you can contact me. I don't know if I would be able to provide you with the answers that you're looking for, but at least I will try. Thank you very much. You have a great day.